Okay, guys, and the last one that we're going to do, it's a two-parter as well, and that is anaphylactic shock. So, if you were in my class, we talked about the difference between allergic reaction and anaphylactic shock. And anaphylactic shock has a lot involved in it. So, if you haven't taken any notes yet, this is one that you either want to listen to a few times or kind of jot down some notes about anaphylactic shock, because there's a lot going on. So, anaphylactic shock versus allergic reactions, what we're going to talk about first. So, an allergic reaction is just a response to something, foreign coming into our bodies. So, allergic reaction, you have hives, itchy, watery eyes, itchy skin, red skin, nothing life-threatening, just a minor reaction to whatever it may be that was introduced. When it moves to anaphylaxis, you have one of two things, or you could have both things. The very first one is airway compromise. So these are the patients that are like, my throat's closing, or I'm having shortness of breath, or you hear wheezing with them. That's that bronchial constriction. You hear stridor, which is upper airway involvement. But you have things that say, holy cow, if I don't intervene on this airway, they're not going to be breathing soon because they're having that difficulty. So that's one. Or they may not have any difficulty breathing, but they have signs and symptoms of shock. So they have that low blood pressure, high heart rate, and they may never get airway compromise with it. But instead, we have that tanking blood pressure, elevated heart rate, pale, cool, and clammy. Or you could have them both. So they could be, complaining of chest tightness or feels like their throat's closing and have signs and symptoms of shock. So when they have that low blood pressure and the signs and symptoms of shock, it's because they have vasodilation, which is just the body's response to anaphylaxis, is vasodilation. So the pipe is big, same amount of fluid, but it doesn't have to work as hard because that pipe is so big. So this is where your EpiPen comes in. An EpiPen does two things. Epinephrine does two things. The very first thing it does is bronchial dilation. So where they say they feel like their throat's closing, or you hear wheezing, or whatever it may be that's that airway compromise, it's going to open that airway up. So epinephrine with that EpiPen, the first thing it does is opens the airway. The other thing that happens is it is a vasoconstrictor. So where we have the signs and symptoms of shock, because the vessels are big, it's going to shrink those vessels back down, and it's going to kick the body into a compensated shock mode. So until the body can overcome that anaphylaxis, it's going to keep those vessels clamped down. That way our blood pressure is good to go. So an EpiPen will throw you into a compensated shock by constricting the vessels, which your sympathetic nervous system should have done, but couldn't. So it's going to shrink those blood vessels down, ease the cardiac workload on the heart. It does speed the heart up, though. Remember that epinephrine, a side effect is an increased heart rate. So that's okay. We should expect to see that regardless, but we're going to be looking at that blood pressure specifically. And of course, it's going to open the airways. So we're going to have the ease of breathing, an improved SpO2. They're going to become pink, warm, dry again, and we're going to be going to that good side. Epi only lasts 3 to 5 minutes though. So if it is a severe anaphylaxis, we may see the tightening of the throat come back. We may see that blood pressure start to drop back down again. Remember that you are allowed to give Epi twice, but you do have to have permission to do so from med control. So if you're starting to see them go backwards again, you want to be thinking about calling in for permission to give that second epinephrine. So again, anaphylaxis is airway involvement or vessel involvement or both. So we could have shortness of breath, difficulty breathing. We could have vasodilation. But luckily, we just have that EpiPen, which fixes both. They do not have to have shortness of breath to give the EpiPen. If they have signs and symptoms of shock, you're still going to give that EpiPen because it's anaphylactic shock. So when we hit the allergic reaction chapter, we go into it in a little bit more detail about exactly what's happening. But for anaphylactic shock right now, that's what you need to know.